I hope it becomes a gold standard in the treatment of PRP. But behind that, it's actually the microbiome, the bacteria, the good bacteria that we are trying to promote. And I'm going to explain to you the link of inflammation on all different arthritis. So if you like this topic, hang on to the last minute of the video. You can post some questions wherever you are, and we are going to start. So arthritis, as most we know, it comes in a different recipe. Like rheumatoid arthritis is most common, which is a part of the autoimmune system or autoimmune condition. Together with Hashimoto's, multiple sclerosis, lupus, they're all the same. They come from, in theory, they come from the gut dysbiosis, and I'll explain that in a few. Second, or another autoimmune problem is psoriatic arthritis, psoriasis that manifests as flaky lesions in the joints and usually affect also the joints, especially the knuckles, big and small joints. The one that's most common that we call as arthritis of wear and tear, that's usually what we know or what we used to, we're taught that osteoarthritis is not an inflammatory condition, but rather just a wear and tear. But beyond that, we now know that osteoarthritis is actually not just denominator for all the different arthritis. No, welcome back.
I was going to buy something, but I see.
No, we are having a talk. Come. Yeah. So sometimes you cannot separate inflammation from aging. When you're inflamed, you age. And there's a term that they coined now as inflammaging. So what is inflammation in essence? Inflammation is essentially the classic presentation of, and so that's the classic presentation of inflammation. But it doesn't, that's the end stage of the inflammatory process. Behind that, before that, is actually inflammation microscopically, and that is measured by very simple tests. And if you are my patient, you will always look for evidence or indirect evidence of inflammation. Fasting glucose, or even random glucose. Fasting glucose is defined not in the diabetic range, but before that. Any blood sugar of above 100, for sure there's inflammation. That's why it's one of the criteria for the metabolic syndrome, which can be explained by the substrate of inflammation. Before you become diabetic, you're already inflamed if you have a blood sugar of 100. But you can never tell that if you don't get tested well. Another source of inflammation is hemoglobin A1C. What is hemoglobin A1C? It is the amount of glycation, which is a process of aging that is a result of the glucose exposed to heat. And in the system, when you are having this condition of glucose, for example, in the red blood cells, it tells you how much of the red blood cell is soaked to the serum glucose, because that's the lifespan of the red blood cell is about. So it measures how many days or how much of glucose your red blood cell had been exposed. The amount of glucose. There's at least 7 substances that they identified as AGE, or advanced glycated end products, properly identified or acronym as AGE. But in reality, these are the same kind of substance or products of aging, usually associated with protein and sugar in high heat. So what I'm getting at is if any of those preparation of food that you like is marinating with sweet sauce and putting it in high heat, like grilling or high oven, that can give you those substances like aging. It inflames your system. For example, chips, because that's generated by high heat. Think about that. The safer way would be to marinate it with lemon vinegar, because that improves your insulin resistance, and also cooking it with steam or boiling is what I'm trying to say. AGE, advanced glycated end products. What is the significance of AGE to identify? Advanced glycated end products will promote decrease in your metabolism. That means you'll still have a lot of sugar in your body because the metabolism is lesser compared to when you don't have that gunk in the mitochondria. The other thing is it can cause, at the far end of the spectrum, is it can cause mutation of your DNA in the mitochondria. Something that you eat from grilling, from high heat food preparation, can mutate the DNA, produce bad proteins, and those bad proteins can produce cancer cells or cancer, promotes cancer. So that's the age. That's why grilling is not. It's not a safe. It's not a healthy way of cooking. Boiling, steaming, or slow cook like crockpot. What else is there in the horizon? Inflammation that can actually settle in the joints, the small joints or the knee joints. If you have arthritis, that arthritis had started long time ago, and in fact, the diversity of your microbiome, the occurrence of arthritis in the near future. There are trillions of bacteria, a balance between good and bad bacteria. But if you have predominance of bad bacteria that produces less of the butyrate or the short chain fatty acid, but rather on the medium chain fatty acid, that's what you call a alpha diversity. So when you think about this, there's the United States is filled with diverse race. And the same in the intestine. If you don't have much of diversity in your gut microbiome, it becomes a problem. Thanks for watching, Ms. Perla. For example, the predominance of bacteria, for example, that's been studied well. Provitella. Provitella is not familiar to many of us. It doesn't cause problems like Streptococcus or E. coli that usually produces urinary tract infection. It only predominates, but it's seldom discussed in the pathology of human disease. That if there's predominance of that kind of bacteria, no diversity, there's a predictability that patient with low diversity or alpha diversity will develop rheumatoid arthritis. There's another type of bacteria also that's been identified called Collinsella. These bacteria will produce citrullinization. Citrulline crystals are the ones that deposit in the joints. Another bacteria that's really studied well in rheumatoid arthritis is what you call Provitella. This is the bacteria that dwells in the oral cavity. That's why I always tell my patients, brush your teeth first thing in the morning after you do your morning offering. So to decrease the population of those bad bacteria that might potentially go to your intestine. You have no idea how much bad bacteria can proliferate overnight, because it's just like when we're making yogurt. Over the 12-hour period that your mouth it becomes a medium of growth of this bad bacteria. That's why you need to minimize the growth before and after. So that's the bad bacteria. So how do you approach? You don't kill the bad bacteria with antibiotics, because you will demolish the good bacteria, like exponentially multiplying every hour. That's why if you ferment like a 10 billion colony-forming units of bacteria, in the next hour, you have 20 billion. On the third hour, you have 40 billion. So on, 160. And eventually at 36 hours, you have more bacteria than any capsule can get. So there are different types of bacteria that have been associated with study. For example, Lactobacillus gasseri. Not only is good for metabolism, for weight loss and waistline decrease, risk for metabolic syndrome. Lactobacillus reuteri, which is also good for skin, also is good for joints. A combination, for example, of Lactobacillus reuteri and Cassia, or even Rhamnosus, are good combination to decrease the symptoms. There's a specific study that was tapped. The combination of Lactobacillus reuteri, Rhamnosus, and Cassia symptoms objectively and subjectively significantly. So the joint pains improve just with microbiome. Why is this? Because the microbiome decreases the production of lipopolysaccharide, which are inflammatory. How do I manifest lipopolysaccharide? For example, when you're running marathon, what do they give you? They give you a silver coat. Why? Because the lipopolysaccharide is increased when you're cortisol, when you're stressed, when you're having a long run. Cortisol goes up, sugar goes up, inflammation goes up. Sugar is very inflammatory. So forget about the sugar with eating less of sugar. So lipopolysaccharide story is that you feel shivering. That is the effect of lipopolysaccharide. That is exactly the symptom when you have fever, when you have infection. That is a lipopolysaccharide effect, that you're shivering. It's not the bacteria that causes you to shiver, but the lipopolysaccharide, the inflammatory substance that is causing this to happen. The microbiome decreases the production of lipopolysaccharide. That is the reason why, and that's just one marker of inflammation. It becomes important for us, the diversity is very important. Not just taking one microbiome throughout your life, but to diversify. That's why good bacteria count on different types of bacteria is important. Diversify your bacteria. Or you can mix your bacteria that you have in one sitting, you're assured of some good variety. So that's the principle of making a bacteria. The second principle of making your gut bacteria healthy is fiber is very important, because without the fiber, you don't really eat that for you. The microbiome needs to ferment this fiber to produce the short chain fatty acid like butyrate, acetate, and propionate. If you remember, butyrate, that's in the butter. Those are good food. Butyrate, acetate, and propionate, that is needed in the healing of the leaky gut in the intestine. And the more, you also need to improve the population of your good bacteria, which also produces mucin to allow bacteria to go in. And that's the reason why you have leaky gut, and dysbiosis, or that lack of balance of good and bad bacteria, predominantly bad bacteria, will produce you're opening up the gates of autoimmune diseases. The more studies are coming out that even osteoarthritis, let alone rheumatoid arthritis, we know that for a fact now, there's more studies. Osteoarthritis also can be predicted if you have less count of lactobacillus or different species. However, with the yogurt that we're making, although we're specifying that this is Lactobacillus gasseri or this, there's got to be other subspecies of the lactobacillus that supports, because it's difficult to isolate those things. So you're good if you're taking a specific type of bacteria, most likely also diversified in other small quantity of lactobacillus species. But osteoarthritis, for example, in healthy mice who receive microbiome transplant, they're healthy mice, and they got a transplantation of microbiome who had osteoarthritis. Guess what happened to these healthy mice transplanted with bacteria coming from mice with osteoarthritis? These young mice, just because of the transplantation of the microbiome, develop arthritis immediately. So you can induce yourself to have osteoarthritis if you don't eat fiber, if you don't diversify your microbiome.